So before we get started, we do have a few housekeeping items. Can everyone please mute yourself except for our panelist speakers and our moderator upon entering the Zoom meeting? You may unmute yourself for the icebreaker and for the Q&A session at the end of the panel discussions. You can do this on your cell phone or by selecting the speaker icon next to your name. During the Q&A session, please use the raise your hand feature, which can be found in the participants section, or you may type your question in the chat box on the right. Please save your questions for the Q&A session towards the end of the presentation. So hello everyone, and welcome to the first installment of our 2020 virtual STEM series with today's focus in science. My name is Sol Vasquez. I am the president of the Prospanica Philadelphia chapter and have been a member since 2012. Our vision is to be the leading catalyst for Hispanic professional achievement. We can accomplish this by fulfilling our mission, which is to empower and enable Hispanic professionals to achieve their full educational, economic, and social potential. These series are designed to share the various types of careers that can derive from these four disciplinaries: science, technology, engineering, and mathematics. During our sessions, we plan to share personal stories on how one has chosen such field and the journey taken to achieve their professional goals. Please mark your calendars for the remaining STEM series that will take place on August 13th for technology, September 17th for engineering, and October 8th for mathematics. I would like to introduce to you our moderator for today, Dr. Marilyn Martinez. Dr. Martinez is currently the Early Intervention Quality Manager at Greater Philadelphia Health Action Incorporation. In her current role, she was responsible for the Ryan White Part C grant, which provides economical support to uninsured HIV or AIDS patients that attend health services at GPHA. She is also responsible for the Medical Case Management and Community Health Navigator departments, which is comprised of 12 staff members. Her professional career has landed her roles at Temple University and Einstein Hospital. Dr. Martinez attained a Bachelor of Liberal Art and Biology from Chestnut Hill College in 2000 and attended medical school at Pontificia Universidad Madre y Maestra and Universidad Central del Este in 2006. She practiced family medicine for 5 years in the Dominican Republic, both in the public and private centers. While in the Dominican Republic, she was a chief medical officer of a public health center located in a rural area of Santiago Rodriguez. In 2012, she returned to Philadelphia, making the city of brotherly love her permanent residence. Her passion to serve the community while volunteering in several community and religious organizations, such as Prospanica Philadelphia, Philadelphia Cathedral Basilica of Saints Peter and Paul, is also an active member of her college mentoring program, where local high school students and college students have the opportunity to meet professionals, learn how to apply to college, and assist with finding resources to ensure that college students graduate. It is my pleasure to introduce to you all Dr. Marilyn Martinez.
Muchas gracias. Thank you, Sor. That's really kind of you. Today we're here to have the opportunity to speak to two local talents, Dr. Ramon Gadea, and our registered nurse, Brunilda Sanchez, who is known in the tri-state community as Cookie. So we're going to go straight to Dr. Ramon Gadea first. Dr. Ramon Gadea was born in Puerto Rico, where he attended a bachelor of, I apologize. Dr. Gadea was born in Puerto Rico, where he attended a Bachelor of Science at the University of Puerto Rico, and medical school from Ponce School of Medicine. After medical school, Dr. Gadea moved to Chicago to complete his internal medicine degree at Northwestern University and a fellowship in infectious disease from Loyola University. Dr. Gadea has been practicing medicine for over 30 years. His medical experience includes former medical director of Esperanza Health Center in Philadelphia, the statewide director for infectious disease, and currently he works at Greater Philadelphia Health in Action as one of our infectious disease providers. Since his childhood, he has been interested in science and technology. His mother was a biologist in PR, a biology teacher at PR, and his father was a public health physician. In February 2019, Dr. Ramon Gadea was exalted to the CROM, which is considered the best STEM high school in the Caribbean, Alumni Hall of Fame. His area of expertise include infectious disease, telemedicine, and developing care teams to serve our disenfranchised community. Thank you for joining us, Dr. Ramon Gadea. Can you please share a little bit about your professional journey?
Of course. Thank you for having me here. Buenas tardes. I was just looking at my, it's always interesting when you hear your own biography, but fairly much I've been compromised. My compromise with science have been since birth. My mother actually was a medical student in Salamanca, Spain, where she met my dad, and she was a semester short to finish her medical career. And when she separated from my dad, she came to Puerto Rico. I was born in Puerto Rico. My mom came 8 months pregnant to Puerto Rico to have me. And through the whole time that I was growing up, my mother, in order to sustain us, used to work as a school teacher. But she was a doctor at heart, but she never got her degree because she was accepted to go to Santo Domingo to finish her career, but she decided I cannot leave my kids there too young. So that whole thing was influenced me. My dad was one of the first doctors to work with CDC in the chlamydia programs in Puerto Rico. And then when the HIV crisis came up, he was working in what is called the Centro Latinoamericano de Enfermedades de Transmisión Sexual, otherwise known as CLETS. That was a project between CDC, San Juan City, and the School of Medicine. So when I was a kid, I spent time, since I have memory, with my mom in the classroom, and eventually she became my 7th grade teacher in biology. So I knew all the answers to the questions because I sit down there and help her out, actually test it, correct the test. And then my dad worked in prisons, worked in community health centers in poor communities in Puerto Rico. And he will take me with him to babysit me the weekends that I was with him and the weeks that and I even did guardias. I stayed overnight with him in New Year's Eve when I was 9 years old in a dispensary in Puerto Rico. So he used to put a white coat on me. That's why I don't wear white coats too much, because, and he said Dr. Gadea, but I was not Dr. Gadea. So I was 16 years old, and there was this HIV patients coming on, and my dad said, this is my son. He's a medical student. I was not even in pre-med. And he's gonna, but say he looks kind of young. I have facial hair, look older. So they say, I know he's your kid, but he was exposed me to all that. So when I decided to make a career in medicine, I had no other option. I considered being a lawyer, but my grandmother told me, she was from Venezuela. She told me, you're too nice to be a lawyer. And, that's why I became a physician. I started my career with the idea to be a medical missionary. I wanted to go overseas. And then I had a good conversation during my medical school years, because I was incurring all the debt that goes with medical school. And I was afraid I would never pay as a missionary. And the director of the school told me, had you ever been to New York? Had you been to the Bronx? Had you been to Philly? And I have been to all those areas because I have family there. So I said, you could be a missionary to your own community. And that clicked something in my brain that maybe I don't have to go overseas. I can serve my community. I finished my training, got married. I wanted to do a PhD in bacteriology and all that stuff. But my wife, we have a baby. She was pregnant. No, she was not pregnant, but said, you need to start paying your loans. So we need to get a job. So I had to stop studying after all these years of school. I was only 28 years old when I had already finished my 2 trainings, because I started school earlier, and I went, just to make a long story short, I was in private practice, Tri-County area, doing better than I ever will do in my life financially, bought a new house, bought 2 cars, and all of a sudden God put in my heart, this is not what you came to do. You need to go back to your community. So I ended up selling everything that I have, give away my practice to 3 different physicians, because I had a really huge practice, and I came to Philadelphia to serve at Esperanza Health Center. So in terms of my experience there, is that every place that I went, there was a crisis. At Esperanza at that time, we needed to get federal funding to keep it afloat. So I was averse to that, but eventually I learned to do that. Then after 8 years at Esperanza, I needed to make more money because my kids were, planning getting older and maybe had to go to college. So I ended up taking a part-time job in the correctional system. And as I went there, people kept leaving the practice. So I became the only infectious disease doctor for 4,000 or 5,000 HIV patients, plus a lot of Hep C. So I ended up having to not create, but to expand our telemedicine services. And in that work, I decided, after 11 years in prison, not that I did time, but it's almost like doing time, that was time to go back to the community because my kids were already finishing college. So I ended up, my good friend, Dr. Janet Young, found out that I was looking for a job and I didn't even apply for the job. She called me for an interview and I got the job. And there we needed to develop an infectious disease team. Dr. Martinez came out like a year later. She knows how I work. We put it together and we created a team that is having high efficiency. And then all of a sudden, COVID-19 hit us really hard. And all of a sudden, I remember that I knew how to do telemedicine. I've been here before. And right now, I will tell anybody that in our audience here, before the interview I was talking about, before we started this, that we had the biggest chance for STEM minded folks to not continue doing what we're doing for medical care. I went to see my doctor the other day at Jefferson Hospital, and he told me the way we did it before, even if we don't have COVID, we cannot do anymore because we cannot have 30 people in a waiting room when we have flu and we have other infections. We have been doing it wrong, but that's the way we got reimbursed. So everything has to be who pays for it, because you can have big dreams, but you have to have people that pay. But we are in an incredible opportunity and to not to think out of the box, just to build the new boxes and create new technology. And also we are in unique positions because our community is huge. And a lot of folks don't really want to go to medical school because they're afraid they're going to get COVID. Like when I went to medical school, people were afraid they were going to get HIV and tuberculosis. So that was an advantage. So as a Puerto Rican kid from public schools, I found opportunities where everybody saw crisis. So we are in a unique turn, and not going to talk too much about COVID, but don't expect anything to change in the next 2 years. So that means you have 2 years to create new systems, and you could be the next, I don't want to use Bill Gates because I don't like him too much for some reasons, but but you can be the next Elon Musk, Bill Gates. You can be the next Jose Rodriguez that creates the new technology for health delivery. And I think that's what we are. And so there's no field. You could be a nurse, you can be a teacher, you could be just somebody that does information systems, and that's where we are. Or you can be the person that organizes meetings like this to bring their minds together. So I am excited and scared at the same time because we don't know what the future shows. But whenever I have been the most scared and when the crises have been the worst, is also I am a man of faith. I believe that's when the best work that I cannot do with the inspiration of what brought me to Philadelphia, what brought me and sustains me every day. I don't survive. I thrive and try to showcase to the world that we had the solution. We had the solutions, not ours, but our when I mean, working with like-minded folks. So
I have a few questions, if you don't mind.
Sure.
I know from conversations that I had with you, how you do a lot of volunteering and education in the community. Can you share a little bit about those experiences and how you contribute to Philadelphia in that aspect, in addition to your role at GPHA?
Yeah. I am known for, I have a friend of mine that started a computer company after he talked to me, and he was doing administration with us. And he tells me, you are the person that I know that has made the most money for people because you inspired them, giving the ideas for projects, and then you don't partake on that. Because I always say, it cannot be done that way. And even if I don't know anything about what they're doing, I tend to identify that. So I have collaborated with a lot of, when I had my first thing on HIV, for HIV, we were the first grant for Hispanic community in the whole area of Philadelphia. And I brought all these folks that were grads, younger people, the youngest, the ones that were coming from Temple, La Salle, and some kids that never have education but had a lot of street on them. So all of that group, and Marilyn has worked with some of them, all of them became administrators in different hospitals. One of them actually became the director of nursing at one of the Temple scenes and went back to Esperanza to be the administrator. When I met him, he came because he had broken a finger and he had no insurance. A lot of people don't have insurance. And he came to see me and I looked at the finger and I pretended that I was gonna break it more. And he said, oh, you're killing me. I said, no, I'm just kidding. And I asked him, the first question I asked, I said, did you go to school? Where you go to school? And at that time, he told me, you homeless. And he was trying to go to Temple to be a doctor. And he was not sure. And I said, you should go back to school. And he never told me. Then when he became a medical assistant with us, he told me, I'm gonna be a nurse. And the next thing, he's the administrator. When he went to rehire me like 4 years ago to do a hepatitis program, because the same thing, they called me and say, can you help us out, even when you work at GPHA now, to come and help us out to this hepatitis program? I say, yes, but I'm gonna put my rules, what we're gonna do it. And then once it's done, I ain't out of there because you're gonna get people that. So he told me when he introduced me to the staff, the day he met me, I was homeless, and this is a Latino guy, good looking, probably now ready to retire, younger than me. He has done the right things, but I didn't know at that time because I was talking to the Hispanic on me, the Boricua in me. I saw him, I saw me the same way that I was in prison. I don't have the criminal record, but I had the same background in neighborhoods that you had. So what I do a lot of stuff in churches. I get invited I have a son with special needs. So a lot of the times that is an adult now, I get invited to groups, but I don't do let's do the downtown with the $1,000 dinner plate. That's not my deal. My deal is you have 2 or 3 people that need help starting something. If I had time, because now I'm more busy with this COVID thing, I'll give you an advice. Like the same way you're talking to me, call me in the phone and I'll do exactly the same to you until you say, please, I got too much information. And then 6 months later, they call me and say, I went back to school, or my contacts are your contacts. And I, I like the Forrest Gump of a lot of stuff. I've been in so many places that I was not supposed to be. So I will share that with you. But my passion is to what doesn't inspire me is when I see a young person and they don't have that desire to do anything. They don't have el brillito en los ojos, that light in the eyes. And I tend to figure out, God, what happened to this soul that he lost that? But if you had that sparkle and the more reckless that you are in desire to do something, the more I do the same with my kids, the harder I'm gonna push you. So and help you out.
At GPHA, we see that. We see how you're very accessible to teach, to provide better ways of streamlining services, reaching out to our needed community. We serve inner city patients who have an array of barriers, right? And we can see how you take a staff and you build them. And that is one of the gifts that I think we have as you being a staff member here at GPHI. Can you share a little bit of your infectious disease endeavors and I call it missionary overseas as well as in Philadelphia?
I forgot to mention that, but when I left Esperanza Health Center, one of the reasons I left is because I had attended a conference in the Caribbean, actually in Santo Domingo, where they were starting to put money in the Caribbean to solve the AIDS crisis. This is 2004. I went February 2004. I was in my sabbatical from my job, and I went there with a family from the Dominican Republic, from San Pedro de Macorís, that were my patients, and they you provided meal. So when I was there, I got a call in my heart, because I call it, it's like dreams, and all of a sudden something comes very clear, and I decided I need to do something. This is not my country. But actually, when I was a kid, my church took me there to the borders of so I always had this heart. And my grandfather did mission work there too. So I decided to start this program, and it was called Access Caribe. And it never really became a solid program in the sense of lasting, but it became like I started getting students that will call me in conference and say, I want to help you out there. I said, well, I go there every 3 or 4 months for a couple of weeks to explore. So every time that I went there, I would have a student from a big university stay there, and then they didn't want to come home. A couple of them married Dominican men and women. So it became that, and they created micro programs. At the end, to make a long story short, I realized that there was the Clinton Foundation was really involved there in La Romana. And then where I was working was in the Northern Dominican Republic, Samana Paradise, the best, but there was a high rate of infections there. So I was able to call, I keep sending the patients to La Romana, and they keep saying, why you don't do it there? So because we don't have services there. So they actually contacted Puerto Plata, the other services that were nearby. So at the end, when I left 26 families that were infected with HIV, that when I met them, I say the families were infected because there was more than 1 or 2 members with HIV, and they could not work. So as they got better, they started their own co-op. They didn't know that was the call, but the neighborhood started organizing. So those 26 families were able, when they worked, to get money to buy the medication and also to provide transportation to take the patient to the foundation. So I didn't left a health center. My name probably will never be known there, but those 26 families became a catalyst to change the community. And that's something that you cannot probably build in the United States. But at that time, when I left in 2009, nobody has ever taken HIV medication, but there was 26 families that they were able to access medications. And I told them how to do it. I didn't create like a Medicaid plan for them and free transportation and all that I did for a little bit, but they were able to find a model that said, Dr. Gadea, in Samana, we know how to do it. You can go back to Philly, we're okay. And that's what I did. Because I didn't, when you do change, you don't want to perpetuate yourself. I've been in a lot of agencies that I work, and you have to leave it better for the person that comes next. I went to Esperanza, the short segue here, to do the Hep C program. And I'd be like doing the Saturday clinic, and then people didn't know that I was Dr. Gadea that started the program, that they were being benefited. And then somebody say, oh, in the book from Esperanza, you're in chapter 8. Oh my goodness, I've been working with you for 3 weeks. I say, what happened? I said, well, I decided to go and make a little money to save my family. I said, well, thanks to you, I have a job. I said, I don't know. You got the job because of your own effort. So we went from a program of 2 people, and then there's like 30 employees for that HIV program now. And the Hep C program, I went to be the only treater, and there's like 4 people treating Hep C there now that are not infectious disease doctor, because we created a program, and that's what you do. And in overseas, that's what I did. And now I don't know what's going on in the Dominican with the HIV crisis, but I know there have been the Dominican that I went to. Sorry, this don't want to sound political. In 2004. Is not the Dominican that exists now, the same way that Puerto Rico is not the same, or Philadelphia is the same. When I came to Philly in 1996, community health centers, there were a few, but not the vibrancy that we had now. So we have come a long way.
I think it's a reflection of passionate providers and doctors and members of our community like you, who go underneath the radar. Nobody knows who you are, but you impact and you help sustain, develop resources in our community. Thank you so much for sharing, Dr. Gadea. I have other questions. Don't go nowhere. Thank you. You're definitely, I consider you a leader in our community. And that's what leadership is all about, building communities. And you have done that overseas and here in Philadelphia and in the other places that you've been in the United States. I'm going to continue with our second speaker. Our second speaker for this afternoon is a registered nurse, amazing friend. Her name is Brunilda Sanchez, better known in our tri-state community as Cookie. Cookie is a bilingual clinical manager at Vallarta Home Health Care. Cookie has been a nurse for 27 years. She began her career as an LPN and later obtained her Bachelor of Science degree in nursing from Seton Hall University, where she specialized in critical care transplant. Cookie obtained her associate degree from Camden County Community College. Cookie is also a case manager for workers' compensation at Allegiant Care. She has served as an ambassador for the Government Affairs Office, Heart for Home Care, and has taken volunteer assignments throughout Vallarta to meet with and strengthen relationships in our legislators and in the tri-state area. Cookie served as president of the National Association of Nurses. I'm sorry, the Nurse Association of National Association of Hispanic Nurses. I probably chopped that, I apologize. For the 2019, she also has been involved in community-based organizations such as Critical Care Nurse Association and the New Jersey Nurses Association and the National Association of Hispanic Nurses. Cookie has served the community through active participation in the Hispanic Nurse Scholarship Program and has served as mentor and to many aspiring students and aspiring medical professionals. Cookie is a member of the National Association of Hispanic Nurses, and in 2019, received the Community Award for her work with the Latino community, presented by the National Association for Hispanic Nurses. She's a loving wife, an amazing mother too, an extraordinary volunteer in our community. She loves to spend time with her 3 grandchildren and enjoy her life, which is dedicated to health and wellness. Good afternoon, dear friend. How you doing? Can you share a little bit about your professional journey?
Hi, good afternoon, everyone, and thank you for having me. I am so excited to be one of your first on the STEM series, so congratulations to you as well. Can you guys hear me okay?
Yes. Before you continue, Cookie, I wanted to highlight that she's on vacation and she has taken time to join us. That's how engaged she is with our community. Thank you, Cookie.
Oh, absolutely. My children are downstairs in the pool, so they're fine. So first, I just want to, so I can resonate a lot with Dr. Ramon Gadea, you know, starting as a child and wanting to be in the medical field. My journey started, I say, my nursing journey, because that age, I had no idea what a nurse was. And in the hospital for several months with an incident that I occurred. And I was introduced to amazing nurses, which unfortunately I didn't know the difference of a nurse, an LPN, a home health aide that took care of me, but not only me, but my family. And I come from a very large family of 11 siblings. So for me, it was really, really difficult. Mommy to come and attend to me when we have other siblings. So these nurses were amazing. And I think at the tender age of 8 gave me that feeling that this is what I want to do. I want to go out and I want to help other people. And I think that's when my journey started to want to help people. At that age, I thought it was cool, right? So then I decided I couldn't do anything. At the age of 13, I decided to become a volunteer that gave me so much energy to work with the clients. And as a volunteer, I wasn't able to do much but to provide a pitcher full of water. But at least it gave me that connection to be able to help someone that couldn't get out of bed. And it helped me feel good. After that, my life, you know, at the age of 17, my life took a little turn. And I became a mother at the age of 17. It was very difficult for me to continue my nursing journey at the age of 17 with a baby, but that didn't stop me. I continued to went to community college, Philadelphia, where I classes where I was able to try to get into the nursing ship. Was I had no to talk to. I did have a counselor, however, will constantly say to me, you know, you're Latina, you have a baby, you're 17, you're 18. How are you expect to go into the nursing field when you have all these obstacles? You know, I recall taking my daughter to class with me because I had no babysitters. So that was really tough, but you know, endurance is something that is in my heart. So I continue to, with my career. So I finished, I was able to finish community college. And as a single mom, I needed to financial comfort for me and my child. And that's when I decided to start an LPN, go to LPN school. It was cheap, 12 months. I was able to get some financial assistance and I became an LPN. And that gave me a little more time working with patients. Worked at lucky a job at Sanchez and LPN. I worked there.
Cookie, we're losing the connectivity.
Not able to collaborate with more.
Cookie, we're losing the connectivity. If you
Okay.
could repeat it one more time, I would really appreciate the part when you went to the LMP classes. Can you hear me?
Able to hear me? I can hear you.
Now I
Can you hear me?
better. We lost you. We lost you when you were sharing about your LPN
sorry.
classes. That's when we lost you. That's okay. Technology. We will get around it.
I apologize. Yes. Okay. Yeah, exactly. So I'll make it short. My LPN, I went to LPN school. I needed a 12-month program. I did that for 10 years as a single mom. So it was really difficult. I worked on the oncology floor, and it was an amazing experience, able to work beside an RN. But I found myself doing so many of the things that the registered nurse were doing, but yet I wasn't getting the money that the RN was getting. And that's when I decided to work part-time as an LPN and continue my education. And I went back to school to get my bachelor's in nursing. And I decided that I always wanted to do critical care nursing. I decided straight after school, take this chance and just
You're breaking
go in
off.
and experience, because they hear.
Sorry, Cookie. You're cutting off.
Are you hearing me?
Now I can hear you. If you can repeat that, because you were cutting off. Thank you.
Did ICU is something that I wanted to do. I wanted to work for at least 1 year in the ICU just to have that ICU experience. I ended up being for 12 years. I fell in love so much with the ICU, the connection with the patients, the family, especially the families. And as you know, you all know, in ICU, most of our patients are intubated, so you communicate more with their family. And that was just very, very rewarding to me. I stayed there for 12 years. During my 12 years there, you know, I started to see a lot of disparities. I was the only Latina nurse in that unit. So I was utilized to work in the emergency room, medical search room. I was pulled from every direction. And I went to see other people that look like me, other people that were able to connect with the Latino patients, because it's amazing when you walk into a patient's room where they can only speak Spanish, and you see that glare in their eye, that happiness, that you go in there. For example, you said, why haven't you taken your medication? And you hear other nurses that don't understand the language, and they say they're non-compliant. We need to understand what non-compliant is. Is it a language barrier? Is it that they don't understand with the medication? You know, me da orgullo be a Latina nurse for my clients. In that time of years, see that disparity, I decided I wanted to get into case management. And I did that for a year, and helped me organize my clients during discharge, make sure they were living in a safe environment, and make sure that they understand. And of course, you know, from there were no resources for me to move the ICU. I said, I need to go back and work in my community. And so that's Jersey, but I work in Philadelphia, and I work in North Philadelphia, where we educate and we provide best care for our community.
Cookie, we're losing you again. I'm not sure if you can hear me.
So that's a little bit of my history.
Okay. Thank you for sharing. I really appreciate it. I have a question or two, if you don't mind.
I hear you. Can you hear me?
I can hear you now. Can you hear me? I can hear you, Cookie. So I have two questions, if you don't mind.
I can.
Like you.
Can you hear me? Sure.
Yes. Thank you. Like you, I was discouraged as an undergraduate to apply to medical school here in the United States. I found several of my counselors and professors I even had a counselor at college who said, you're Hispanic, you're going to be barefooted and pregnant, and to manage medical school and that scenario. So I thank you for sharing. A lot of us have experienced through this journey, different leaders or different people are there to support us. Instead of uplifting, for whatever reason, we're discouraged to go in the medical fields, in nursing, health management, radiology, doctor. So thank you for sharing that. How has that influenced you to encourage an increase in your field, your respective field, so that we can see more of our own people in those fields? How did that experience influence you?
Absolutely. So are you able to hear me?
Yes, ahora sí. Yeah, I'm hearing you now.
Okay, great. Yeah, so, you know, I was lucky enough to find this organization, National Association of Hispanic Nurses. And that's where I started to wanting to reach out to schools and being able to mentor these students that are interested in the nursing field, and try to them in there. But you need to continue. You need to give it all you have, because, you know, we're only maybe 7% of the Latino is nurses, and that is really scary. That is really scary to our community. So again, our mentorship program is very, very important.
I also know that you are very active in volunteering. You're very resilient. You're not only in New Jersey, but you're in Philadelphia. You make sure that volunteering is such a big piece of who you are as a professional and as a person. Can you share a little bit of some of those experiences with us this afternoon?
Sure. And again, I started all these community events once again when I started with none. Again, I had no mentors during my growing up. We do so many different volunteer work. We collaborate with Concilio. We collaborate all the majority of high schools, where we go to the homeless and we exchange sneakers with Pastor Ben. That's one of our greatest events that we love to do. We go out there Saturday mornings and we feed the homeless. We clean their feet. We change, we heal their wounds. You know, not too many people want to do that, and it gives me chills just to think that us as nurses and as community leaders, we're out there on a Saturday morning helping these that are in need. We also collaborate a lot with the Concilio. We do a lot of blood pressure screenings for our Latino community. We do a lot of events where we teach them their numbers. You know, they go to the doctor's office and they have no idea what their blood pressure is. They have no idea what their cholesterol level is. And this is so important for you to maintain healthy. So these are just a few volunteer works that we enjoy doing for our community.
So thank you so much for sharing, Cookie. I really appreciate it. I appreciate both of you sharing your journey, what eats into your passion, respectively, in each of your fields, and that beautiful, those beautiful experience that has led both of you to where you're at. So we're going to continue now with the Q&A. There's a series of questions that we have for our guests. Some of them I'm going to skip because you have already answered them. Feel free to each one of you respectively to answer whichever. Dr. Gadea, if you don't mind, let's do lady first, if you don't mind. And then some of these questions I might ask specifically one of you because I didn't hear it in your journey. And some of the questions will be asked to both, okay? So starting with you, Cookie, if you don't mind.
Sure.
Thank you. What has been the best advice you have ever received, career-wise?
I think one of the best career advices that I have received was after graduating from nursing school, I was told by a very good personal friend, now you have the knowledge, now you have to pass it on. Yeah. You know, we see a lot of nurses that, you know, go to work, they go to work, they come straight home, and that is it. In order for you to succeed, you have to provide what you have. Give back to our community. Don't just sit around and don't just go to work, come home, give back to your community. That is so important. Your knowledge, share your knowledge. So I think that always stays with me when they ask me what is an advice that was given you and an advice that I would in return give to some students, especially nursing students. You got your education, you have that knowledge. Now let's work on it and let's share it. Let's share it to others and inspire others.
Thank you, Cookie, for sharing. Dr. Gadea, same question to you. What has been the best career advice that you have received so far?
In my childhood, my mom used to say, lo que vayas a hacer, hazlo bien o no lo hagas. You know, whatever you're going to do it well or don't do it, and prepare yourself. So I don't care if you're a plumber, be the best plumber. And she will say that to me. Right before I started my career, my dad gave me the advice that got me here because I wanted to be a pharmacist. I was 20 years, I finished high school when I was 15 years of age. So I wanted to go to school for 4 years and start making money. And my dad said, why you not going to be a doctor that you wanted to do? I said, because that takes too long. I said, Ramoncito, el tiempo va a pasar como quiera y es mejor que pases haciendo lo que a ti te gusta. Time is going to go by anyhow. Now that I'm 55, and my dad gave me that piece of advice. My dad's not with me anymore, but it's one of the few times that I listened to him because I used to bump heads with him. And it was the best advice that they gave me. And then the best advice that I got the other day that I almost like decided this is too much. My pastor told me, whatever you're gonna do, don't be miserable at it. If you hate your job, change it. Don't be miserable. And I realized I love my job. I don't like some stuff that happen, you know, because like we all do every day, but I'm not miserable at it. So say, so you're not miserable at it, it's not time to change. The day you're miserable, that you walk there and you don't want to get to work, and it's not because you don't like some coworker, it's just because you hate the job, please stay home. Uh, so, so that's a, you know, pre-employment, before education, and to maintain my employment, I have to be not happy, but to have the joy that they talk in the Bible in Philippians, that no matter what happens, you're in the place that the cosmos or whatever you believe put you there. So enjoy it, enjoy the ride. You know, it's yeah.
Continuing with you, Dr. Gadea.
Okay.
What is the biggest risk that you have taken professionally thus far?
Well, moving, having two babies that were under 2 years old, selling a practice to go to Esperanza Health Center to work for $50,000 a year. In 1996, my wife was a nurse, and she was a critical care nurse, really well trained. And then she was working in my office, so I can have an office. We came to Philadelphia with no money. I ended up with $70,000 to $80,000 in debt because I wanted to do. And even my mother said, "You are more crazy than I saw you were, but I see you hard, and I will support you." And my wife went to work at Holy Redeemer Hospital, those horrible hours that nobody works, the weekends that pay more. I hardly saw her. And then by the grace of God and the government of Pennsylvania, I got my loans prepaid. And at the end of 8 years at Esperanza, I had less debt. I came with $70,000 in debt because you close a practice, I almost had to give my new home away. And when I look in 2001, right before September 11, when I moved to this house that I live now, I remember saying, I have credit, I can afford a house now, but it has to be around a lot of money that has to be between mission organizations paying my loans. A lot of stuff happened, but the risk was worth it. And my mom told me, I never doubted you. And then she said, no, actually I doubted. I think you were crazy, but I love you too much that I was not going to tell you that because I don't want anybody to break my little Monchito's heart. And I never forget that because she really saw I was crazy. But she said, but you always do your best job when you're crazy. When you act crazy, is a word that should be when you are not, when you're taking the risk. And so, because I had no way to know I was going to be successful. No way. Look back, and I scared to death. I will not do that decision again. I will have paid my debts, move, sell the house when a better market is, and we had taken 2 years. But if I had waited 6 more months to come to Philadelphia, Esperanza would have closed because Esperanza actually ran out of money when I was there, and that's when. And I know they talk about it, but at that time nobody wanted to admit that they were ready to close. So I think God sent me with a purpose, not for me to find folks that were willing to keep the health center open. That was the medical assistant, the people. I had the medical assistants that were poor in resources, not in heart. And one day I say, I don't have food for my family because really we had not been able to pay the staff. And I walked there and they went to the local bodega and I have a whole box of Producto Goya. I know that's a joke. Everything, stuff. And they say, Dr. Gadea, we don't want your family to go hungry. Folks that had less give me so much. And that's because they knew if I quit, there was no, how were they gonna go? And then if they had quit on me, we were fritos, like they say in Puerto Rico. We were cooked, but it did not happen. So the perseverance of the people that you less expected, that love you, that respect you, that you probably had done nothing for them, but they love you, that pure love, it's the answer. So I take I would never do that again. Honestly, I negotiate my contracts now, like really, and it's different because I learn, but but I always willing to hear that voice that says it's time to move, and wherever you go, you'll be sustained. But I cannot sacrifice my family. But I actually did, and at the end, it was not. The ending was well because I'm here talking to you, and I've been in Philadelphia almost 20 years now.
Thank you, Dr. Gadea.
25
Looking the same question to you. What has been the biggest risk you have taken professionally thus far?
So I must say two. The first one isn't professionally, but being a mother at 17. That was one of the biggest risks that I had to endure. Today I have two beautiful daughters. My second daughter was born when I was 27. You learn lessons, right? First one 17, the second 27. Today they 30 and 39.
Wow.
So, and they're very two educated, wonderful mothers that I'm so proud of. And I hope that I'm able to encourage them in different ways. The biggest risk that I have taken professionally has to be becoming the president of non-Philadelphia. I don't like to. I've never led anybody. I never led a team. We have 40, maybe 40 members in my chapter, and I led these members as a leader. I became a leader, and it was because they encouraged me so much. They were a group of amazing individuals that I work with. And when you lead with your heart, nothing's impossible. So that was one of my biggest challenges.
Yeah.
Thank you for sharing. Is
Sure.
there any advice that you would like to share to our audience? That would be my last question. Any advice that you would give to this audience? They're young professionals, they're students, college students, just like each one of us. Is there any advice that you would like to share? Dr. Gadea, I'm going to go with Cookie first.
Okay.
Cookie, if you can answer that. Cookie, we cannot hear you. If you can unmute, thank you.
Can you hear me, Madeline?
A little bit.
It's cutting off a little
Dr.
bit.
Martinez?
It was cutting off. Now I can hear you. Now I can hear you. Yes, now I can hear you.
I'm sorry, I didn't hear what was said.
Is there a advice you would like to share with our audience this afternoon?
Never give up. Never give up in something that you put your heart to do, your mind, your soul to do. This is something that you have to put yourself first, and also don't overconsume yourself in what you're doing. Work hard, work very hard. Let me tell you, as far as nursing school, I'm being honest, it is no joke. Nursing school is definitely hard, but don't overconsume yourself. Make time for yourself, because if you're not healthy, you're not going to be anybody else. So wellness, health is very important. So yeah, work hard, don't overconsume yourself, and definitely it's not being selfish to take care of yourself.
Thank you. Thank you so much, Cookie. Dr. Gadea, the same to you. Is there any advice that you would like to share with our audience?
They say in my church,
Sure.
Cookie, I needed to hear that word because I didn't take care of myself for a few years, and the last 2 years I became healthier, but I wish I had been more careful. But what I really believe, I have a secret. The jobs that I had tried to apply, that I apply, I don't get. The jobs that I don't apply, and I talk to the person, I create, and I go there and I get offer. Because when I present myself, the way I'm talking to the audience, I am plain simple, and people say, "Wow!" Like I have a patient just to tell me, I went to school in Calle. Talking to you is like I talking to a kid in the neighborhood." I say, because I say I speak different languages. I speak Spanish from North Philly, Puerto Rican Spanish. I could be very high up if I want to be, or I don't, I level where I had to be. So, but at the end, I am a kid from a barrio. I am a kid that if I'm gonna talk to you, I'm gonna be me, because one day when they hire you, if you know who you are and you're not staying healthy, the day they have to kick you out, they're gonna kick you out. They don't care. Especially if you're Hispanic. I'm sorry to tell you, you'll probably be the first one in the chop block, even for Hispanic organizations, because I collaborate with all them. Because at the end, being who you are is what's gonna keep you there, and it's gonna give you durability because you live with yourself. You go home, you had yourself. Don't be miserable. And what I could do if I was younger, like you had that question that I put on here before. To the younger myself, I will say to you, don't be so anxious. It's gonna be okay. You will see. And whatever is not for you, como a mí me decía, lo que no es para ti, no es para ti,
Yes.
forget it. God has something better. And I believe that. But be yourself. If you know yourself, you're gonna be exposed. And but what Cookie say about staying healthy is very important, because medical school, nursing school, anything that, if you do it well, you can go to medical school and be a complete, do nothing, and you became a nursing doctor. And you maybe drive better cars than me, but you be nothing because you never put the work. Anything you put the work on it. But remember, in order for you to be healthy, it's like in the plane, when you get in the plane, and what they say to you before you say your kid, be sure that you had your, like, I don't know, this mother Naya Rivera, you know how she didn't have a life device, and she dropped from the boat, and she put all her energy in saving her little kid. Imagine if she had a life vest, how different would be the story, because we had to be ready. She said the kid, but unfortunately the kid doesn't have a mother now. So that really disturbed me, that the sense that's simple advice, but if you're not taking care of yourself, you cannot help anybody. It's absolutely Cookie. I came here to talk and listen, but you hit me right here, because I that's the word I needed to hear today. Yeah.
Thank you both to Dr. Ramon Gadea. Thank you for Cookie for your life experience, and also for sharing and answering all our questions. In our ending remarks, we have been together for over 50 minutes, and it's time to say goodbye and good afternoon. I just want to highlight a few things before we leave. At Prospanica, we're constantly, proactively searching for new members. So if anybody resonates with what you saw in this webinar and you would like to be a member, feel via our social media platforms or through the email, right? I can be reached at mmartinez@gphainc.org. And if you are a member and you like what you saw today and you want to be more active, because you heard these two wonderful talents, local talents, Boricua, that are so passionate, and you want to be part of one of our subcommittees or support one of our chairs, again, reach out through the social media platforms that we have through LinkedIn, Facebook, and definitely follow up with you. Through this STEM series, we're using this platform to make sure that everyone in our community, especially our members, our guests, have an opportunity to get an insight in these fields, and engineering, and science, and technology, and in math. Our next webinars will be taking place in August 13th, and in September 17th, and October 8th. So we look forward to having you participate in the series, coming back and sending us feedback. This recording will be available on our social media platform in a week or so. So be in the lookout we're going to be sharing and sending information. I wanted to say thank you to both of our speakers this afternoon. Thank you for your energy, your passion, your work. I've been able to be in the same space that you guys have been as volunteers. Cookie, we did an event in North Philly that I loved your team. You guys are amazing. Thank you for all the hard work you do. And most of the time it's not noticed, but you're being noticed by a few of us. And your patients are very grateful, and our community is really blessed and fortunate to have leaders like you. Thank you to the board and the members of Prospanica for attending and participating, share this information. We are here to uplift each other. We're here to build a stronger community, and we're here to have a positive impact. Life is very short, and it's more fun when you're passionate, engaged, and uplifting one another. Thank you so much. Have a great afternoon. Thank you to everyone. Kimberly, thank you for all your technology support. Jessica and Sol and the whole entire board, thank you so much. Have a great afternoon and enjoy the rest of the day. Take care. Bye-bye.